Good evening, Winnebago. This is the Thursday, September 10th, 2020 weekly COVID-19 updates. At this time, we're going to turn our attention and turn the floor on over to the Winnebago Health Administrator, Mona ZUFFANTE, for this week's update. And then following Mona's presentation, we'll have updates by the Winnebago Public School, HCI, Mayan Beltran from Winnevegas, Little Priest Tribal College, and also the chairman of the Pandemic Task Force, John Snowball, will be on. Mona.
Good afternoon, Winnebago community. The seasons are starting to change. It's crazy here in Nebraska, from 90s one day to 50s. You have to love our weather. But we're continuing to monitor everything that's going on, and we report them as we identify them. So as you can see, for this week, we have a total of 104 positives, 97 have recovered, 4 active positives within the Winnebago, and we have 649 negatives and 3 deaths. So some of the program updates we did start the shuttle this week with a limited amount of people from the Urban Indian Center on Geneva Street. The shuttle will leave the Indian Center at 8:30 and 12 o'clock daily. And then we'll leave 12 Cleanse Unity Hospital at 11:30 and 3 o'clock, with the exception of Wednesday, where there is no 8:30 shuttle. The passengers will be required to get back onto the shuttle, a return pass, and then we'll take you back to the Indian Center. The hotline reduced its hours this week from 8 to 4:30 daily, and this was because we were monitoring the amount of calls that was occurring and just made adjustments to it. This is a source of information, but not for emergencies. And therefore, it was noted that people were calling more during the daytime hours. Also, since the outpatient is taking calls directly for testing, this has also reduced the need for extended hours. We will continue to monitor it, and if we start to see more calls after hours, then we will discuss it at that time and then change the hours if needed. Whirling Thunder Wellness Center, also their workout rooms and the pool changed from 8 to 8 Monday through Friday. We will look at opening up additional hours, hours and the gym starting on the 21st. This will be limited to about 6 people in the gym on one side. We're also going to be looking at opening the other areas to our children from 14 to 18 years of age with an adult. We're going to be also looking at adding water aerobics classes. Hopefully some of you have seen the flyer for the Remembrance of the Suicide Awareness Month. There will be a virtual walk. The deadline is September 24th to register. You can send a picture of your mile to Bobby Wolf at ihs.gov between September 19th and the 25th. The elders will have an option of walking at Land of Wellness on the 25th from 9:30 to 11:30. T-shirts can be picked up for those that participate on the 25th at Land of Wellness from 11:30 to 1. Now, as the seasons are starting to change, flu shot clinics, we have received the vaccine, but we're going to be looking at setting up our clinics here very shortly, possibly outside, and to have your friendly PHN administer that vaccine, or of course, I'm sure the hospital will have other areas, but that's still very early. We just received word. So we'll be getting out that information very closely. I know there have been a lot of discussion about the vaccine for COVID, and we're also monitoring that and watching that. But I also want to remind people that basically trials that are occurring are currently watching those that have received the vaccine to see if they will get COVID-19, which takes several months. But we will continue to keep all of you updated. We will always watch what's going on around us and alert you as soon as we have word. Remember to like the Winnebago Public Health Department's Facebook page. It will have the latest updates and activities that will be occurring, and just continue to wear your mask and practice social distancing where applicable. Thank you very much.
Thank you, Mona. At this time, we'll turn our attention over to the Winnebago Public Schools, Mr. Dan FEHRINGER, for the weekly update. Dan.
Good afternoon, everyone. School has started finally, and we are finishing the first week. There have been some hiccups along the way, but we're getting them figured out. Also, I want everyone to know that John Blackhawk came through yesterday and did a blessing through each classroom and for all students and staff. And that really, I think, helped us all out from that end of it, and it made us feel safer. I want everyone to please pay attention to the reminders that are being sent out, as they'll be continuing as things evolve daily. Safety measures are in place and the students have been great. All fall sports other than varsity football are still going as planned. Volleyball has had 2 games in a tournament. Cross country has had 2 events. We have our first volleyball junior high tonight, and a varsity game at Wall Hill. Things are going well. Safety measures are in place and being followed. I want to remind parents, guardians, and community members that only 4 fans for each student athlete are allowed to home games. The names must be on the list to enter the game. All varsity home games will be live streamed. This will allow us to follow health and safety measures better. And again, continue to practice safety measures. Our kids have been great up here at school. We are taking temps as they come in. The staff is taking temps. Some of them, we go back and check a couple of kids if they're a little bit, like at 99, we go back and check an hour later, and if they're down, we have sent kids home at 100.4, and then they have to follow that protocol. And so we're working on it, and we'll continue to work on it, but knock on wood, everything has been going good so far this week. Thank you.
Thank you, Mr. Fehringer. At this time, we'll turn our attention over to the General Manager of Winnebago for the weekly update, Mayan Beltran. Mayan.
Good evening, community. I want to say blessing and wish well to all the families who are dealing with the pandemic right now, currently, and in the future. From Winnebago Casino Resort this evening, not much different than last week. Not a lot going on as far as any response to the pandemic. However, I just wanted to reiterate, please wear your mask, practice social distancing when you're coming into the casino to protect your families and your friends. Thank you.
Thank you, Mayan. At this time, we'll turn our attention over to President of Little Priests, President Patil. The floor is yours.
Good evening, the community of Winnebago tribe of Nebraska. I hope you and your family are doing well. First of all, I want to wish Winnebago Public School the very best as they start the new school year. Update from the Little Priest Tribal College. We are very honored and excited to celebrate Chief Little Priest Week this week. So as you might have seen on Facebook and other places, we are doing multiple virtual activities. So I would highly recommend for the community to participate at the college activities. The fall semester has started. I feel everything is going well. Students seem to be more active on the online stage than what we expected. So we are very excited to see that. And we request all the students to keep can do.
I'm sorry, President. You're kind of breaking up a little bit. Can you repeat that?
Was in contact. If there is anything we as the school has and more employees in terms of cleaning, sanitizing amount, already working for spring semester, and more information will be shared. But at this time, I just want to thank the Pandemic Task Force, Tribal Council, the subcommittees for guiding us during this time. Take care and have a good day.
Thank you, President. Just to kind of recap, you did cut out just a hair. What was that that last update that you had?
Me?
Yeah,
Here?
yeah. You cut out during the middle of that update.
Oh, was it about the employees?
Yeah. Can you repeat that?
Oh, okay. I just wanted to reiterate that the employees are working more from the office, but we're taking enough precautions in terms of cleaning and sanitization maintaining social distance. So we are being very, very careful as we go into the fall semester.
Oh, okay. Thank you. Appreciate that. Sorry about that. Might have been a glitch on our side, but we're going to continue on here with HCI, the communications manager, Mr. Sam Burrish. Sam.
Good evening. I have one event to talk about today. The Ho Chunk Inc. annual Winnebago Community Celebration is taking place this month as a socially distant drive-through event. Please mark your calendar for Tuesday, September 29th from 4:30 to 7:30 p.m. The drive-through event will happen in the Ho Chunk Village and follow safety precautions. We'll have free meals to go, giveaways, and door prizes for lucky winners. All of that without leaving your car. The purpose, like all years, is to celebrate community progress and partnerships. We'll also have a family-friendly scavenger hunt that participants can safely complete on their own several days after the event with the option to win additional prizes. So please mark your calendar. Again, that's Tuesday, September 29th, and you can find additional information for the event on the Ho Chunk Inc. Facebook page. Thank you for your time.
Thank you, Sam. Is Brian from Ho Chunk Community Development Corporation, are you on, Brian?
No, he's not, Garen.
Okay. All right. We have the chairman of the Pandemic Task Force, Mr. John Snowball. We'll turn the floor on over to you, John.
Yes, thank you, Garen. Just wanted to say that I think we're really doing well, and that these weekly updates have been really beneficial, and to the point where we don't have that many questions, and we're looking at different ways to get information out. And so I would attribute that to the community, really informing themselves, and we're coming to a point where we're really have a lot of momentum in fighting this pandemic. So I wanted to say thank you to everybody that's been a part of these weekly updates, and everybody that tunes in. And looking forward, we're really expanding. Soon there's going to be an opportunity for people who might not have computers or things that they can actually come in and take part in these community weekly updates. There's going to be a screen and a place to get the information, get the latest information. So it's a really big step forward in the communication area, which is huge. It's really something that's really vital right now, is in this era of social distancing, that we continue to communicate. And I think we did really well in that area. So saying that much, I just want to say thank you to everybody that gets on here every week. And of course, thank you to Garen for leading us up and heading it up, and making sure that we're all ready and we're all prepared, and we're getting all the questions, and all the questions are being answered. Thank you.
Thank you, Vice Chairman Snowball. At this time, we'll turn it on over to Emily, the Communications Director for the Winnebago Comprehensive Healthcare System, for the question and answer session. Emily.
Thank you, Garen. Before we go into the questions that community members submitted through our email address, which is COVID@Winnebago Tribe, you can submit your questions for next week by emailing us on that email address. I do have two announcements. One, Mona mentioned the flu shots becoming available through the PHN clinic. I did also want to mention that our pharmacy department has received our flu shots and has started now distributing them. So you can get them through the pharmacy. It's for individuals 15 years or older. If you have a child younger than 15, you'll need to call the outpatient clinic to schedule an appointment to get the flu shot by the outpatient department. And the outpatient phone number is 402-878-3404. It's super important as flu season approaches to get the flu shot. It helps protect you, your family, and the community. So we're encouraging everyone, especially times with COVID, to stay up to date on their vaccinations, and more information and clinic flu shot information will be coming out shortly. So please tune into both the health department and hospital Facebook pages for the information. And then next is COVID test results. So we've had some people calling our health information management department wanting to know their test results from their COVID testing. We encourage everyone to wait at least 24 hours before calling the outpatient department or your nurse or provider, because it does take a little bit for those results to get back. But the Health Information Management Department can only assist when patients are inquiring about their medical records. And even in that case, patients will need to go fill out a authorization form and return it to the HIM department. You can find that form on our website at 12clanshospital.com or by calling HIM, and they can mail or fax the form to you, and then you'll have to return it. So that's the updates I had for WCHS. So we'll go ahead and go into our question and answer session. Again, if you have questions, you can email covid@winnebagotribe.com, and we will do our best to answer them next week on our next COVID update. So the first question is, what's the reason for the 4 cases in Winnebago? I know they can't say names, but can you tell us if it's a community spread or isolated to a certain event like a powwow? Mona, can you take that question?
The 4 new cases that we do have in Winnebago is attributed to community spread from outside activities. None are related to the powwow at this time.
Okay, great. Thank you for that information, Mona. In relation to that, another question, can you break down the cases to ages, or is the young or old getting the virus? Are we seeing a trend in age, or is it kind of everywhere at this point?
So I did take a few minutes to break down some numbers, and I will make sure that we include this in next week's live so you guys can see an actual chart. But I ranked them. So 8% of our positives were 60 and older. 9% were between 50 and 59. 15% were between 30 and 39. 16% were between 40 and 49. 20% were between 0 and 19 years of age. And then our largest one was 32%, which was between 20 and 29. So we are just working through some of our software that we were able to get through our CARES dollars that will be able to really help pull and make a dashboard for us. So I'm hopeful that, but I can still do the Excel stuff very quickly and get that in next week's report.
Wow, thank you for doing
great.
that. Emily, I just have one quick announcement here before we go on to the next question. That actually is useful information, but we also want to announce here that next week we're going to go bi-weekly on these weekly live streams. And so everybody kind of mark their calendar if you're kind of wondering where the stream's going to go. It's going to be, mark your calendars. Today is the 10th. So we'll be back on the air on September 24th. It'll be the next weekly, bi-weekly live stream. Emily.
Yes, thank you, Garen. And with those numbers, Mona, those are numbers based on the total cases, not just the current active cases, right?
Right, that's not 4 people.
Okay.
So yes.
Yeah, just wanted to clarify that. Okay, great, thank you.
Yes.
All right, the next question is in regards to the school. So I'm going to direct this to you, Dan. How is the school handling the pandemic now that they are open? We have active cases, and what is the threshold to start homeschooling?
What we'll do is we'll follow our plan that we put out there back in July. We also are in contact with the health department continually, and they'll update us on where we should head and what we should do. We have, like I said, we follow protocol. We've sent kids home with 100.4 temp, And then they'll come back if it's good. We contact the parents right away, either through text messaging or the phone calls. As far as staying at home, that will be in collaboration with the health department if we would ever go all virtual. Like I said, this week has been really, really good for us, knock on wood. And so we're just going to follow the plan and stay as safe as we can and be in constant contact. We did have a situation that the health department from Wayne contacted us and also contacted Mona and sent the information to us on a person. We had another person tell us that someone in their household, so that person is quarantined. We have that. So we're following all the guidelines and getting all the information and constant, like I said, we're just in constant contact with the organizations.
Great. Thank you, Dan. That's very helpful information. Next question is in regards to the vaccine for COVID. Mona, I know you mentioned this in your update a little bit, but in particular, they wanted to know if the vaccine will be safe for diabetics. I know there's not a lot of information out, but if you wanted to comment on that or...
I mean, I know that there's a lot of companies, well, several, maybe about 4, are working on it. And it typically takes about 18 months to actually monitor people and find out some of the results of those trials. Because basically it's people walking around not getting COVID that were vaccinated. So unfortunately, I mean, all of those are great questions, and we're just really gonna have to wait and see on when they release it and what those studies look like. I personally don't think that we should rush into anything. You know, we really want to make sure that the research was done and conducted appropriately before, you know, we start signing up for that vaccination to be performed on our people.
Yes, thank you so much for that. Next question is from Mayan. So it's at the casino. Why is the council trying to expand the casino in the middle of the pandemic? In the meeting, they said they had a feasibility study. Was that done before or after the pandemic? Ryan, can you answer that one?
Yeah, so actually we've been working on casino expansion for many years now, and we've had a few feasibility studies done. Yes, this one was done before the pandemic, and actually the last one we started was in 2019. So earlier this year, we were given a directive from tribal council to look at, possible ways to make more money in our gaming establishments. One is an opportunity for expansion of casino gambling in Nebraska that HCI has been working on through the state of Nebraska, gathering signatures, trying to get it on the ballot. Another angle is if that doesn't happen, then we have to do something to expand Winnebago's casino resort so that we can expand revenue generation for the tribe. So looking at that, that was done. We had a meeting right before the pandemic hit, and then we closed. So now that we've been open for a few months and gathering steam and bringing revenues back, it's come back to the forefront of obviously, money coming to the tribe is important, and for all the programs and things that happen. So it's come back to the table to say, hey, we still need to figure out how we're going to make more money for all the programs and for the tribe. So let's start figuring out what we can do with the casinos if the Nebraska gaming doesn't happen. And that's kind of what I gathered from the meeting yesterday. It wouldn't happen overnight. And yes, we have to take the pandemic and what happened into consideration. So this is strategic planning of what can happen in the next so many years. It's not that it's going to happen and we're going to start expanding during a pandemic. We still have to start generating revenue here to be able to afford to do it as well. And we're in the process of doing that right now. So it's more about strategic planning and getting ready for that type of expansion in the future. And based on what happens with the Nebraska gaming and with Winnebago as a whole.
Okay. All right. Thank you, Mayan, for that answer. Our last question is for the tribal council. So, John, I'm going to direct this question to you. The question is, how come assistance is only the head of household?
Okay, thank you. And then before I move on to that question, I'll just touch on the casino expansion. Like Mayan said, it has been talked about. It's something that has a lot of support from the table to expand our casino and look at different ways to stay competitive within the gaming industry. And the council passed a resolution to continue with that. And I just wanted to assure all the membership and employees that we're really taking our time with this. And we also understand that we need to plan ahead, plan for after the pandemic, that old saying, the people who are failing to plan are planning to fail. So we're looking way out ahead when we're full bore again and how we're going to expand. So I wanted to assure everybody that there's no going to be hasty decisions. We're really patient, but we're also want to be smart and plan for years out and how we're going to be better and provide more funds to the tribe so we can put them in the services to our people. Real simple things that we want. But moving on to the question for the CARES Act, why is it only head of households? These CARES Act funds are going to be audited, and the task force and the council was really confident in moving forward with giving assistance to head of households, those are the people that would be affected as far as they're paying rent and they're paying probably additional child care, higher food prices, and that we could justify that within the CARES Act guidelines, that would be justifiable. And there was really big concerns because it was brought up. Well, can we help everybody? And it was big concerns about doing that because it would be hard to justify. There's so many variables throughout our membership, but with the head of households, we really felt confident that we can move forward and with helping them and that during the audit it would turn out good, and that it would be reckless if we just dispersed funds to everybody and even myself, that I myself haven't been affected too much by the COVID. I was fortunate enough and other people were fortunate enough to continue with their jobs and so we wanted to make sure that the funds were reaching the people that were being affected the most, and that it was justifiable when the audit comes. Thank you.
Thanks, John. And that concludes the Q&A for this week. Again, I wanted to mention that we are moving to bi-weekly updates, video updates, but that does not mean that we won't be updating our pages daily for information. So log on to our websites, WinnebagoPublicHealth.com and 12ClansHospital.com, as well as all of our Facebook pages and the Tribes page. We will be posting daily updates, and especially updates as our COVID numbers change. We will be making those announcements as they happen. So thank you everyone again, and we will see you in 2 weeks.
Thank you, Emily. I just have one quick announcement, folks, before we let out here, and that is regarding the round 2 of the housing and utility assistance application. Just to FYI, if you jump onto the Winnebago Tribe's website, www.winnebagotribe.com, you'll go and you'll see a COVID info tab, and there's some COVID-19 updates, and then on the second tab there's the CARES Act housing and utility assistance application for round 2. For those that received round 1, they will still have to apply for round 2, and the application is there. It's a fillable PDF, meaning that you can type in the information and then save as, and then send it to WTN Human Services at Winnebago Tribe, that email, or you can give them a call at 833-568-7882 during Winnebago Tribe Human Service business hours. And so they also said that to make sure that you folks attach copies of those utility bills so that they can receive a complete application. And I think that's about it. So once again, we appreciate everybody, and stay safe, keep using those precautions, and we'll see you on September 24th. Thank you, folks.
Thank you.
Thank you.
Everybody.